a lot of global collaboration. There's also been a lot of funding that has been made available for this work, and also the work that had been done in the past. Scientists have been able to build on that work. And I just want to give you one, other information here is that a lot of people may have already read about it, but some people may not realize that the Pfizer vaccine was made in collaboration with a couple of Turkish scientists living in Germany who were already working on the messenger RNA to make technology to make the flu vaccine. And so when the pandemic hit, they quickly pivoted their work towards the manufacturing of the COVID vaccine. So essentially, it's a very long-winded way of saying that none of the steps were missed in the production of these two vaccines that are available right now.
Just out of curiosity, were you a participant for the vaccine trials?
No, I wasn't. I wasn't a participant, but with my experience with the vaccine research, I have sort of looked at it very closely, how they're doing it, and so it's been kind of an interesting journey.
I think this is a hot question for the past 2 days. Can vaccine actually give you COVID-19?
The two vaccines that are available right now, neither Pfizer nor Moderna, neither of them have the virus in it. So neither of them can cause infection. But I think it's important for people to realize that once you get vaccinated, it does take 2 weeks for you to develop the antibody so that you're protected against the infection.
But you still have to put your mask on.
Absolutely. Yeah.
For my next set of questions, I'd like to ask Dr. Maliha, why do we need 2 COVID vaccines and why not one?
Why not one? So right now in US, the 2 vaccines that we have, Moderna and Pfizer, they are 2-step, 2-series vaccine. So the first vaccine you can think as your body is getting prepped, it does give you immunity. You can just call it a priming dose. Then it's the second dose that actually gives you a much more durable, longer lasting immunity, more robust immunity. So very important, as of right now, the recommendation is to do 2 vaccines. So it's just the way we did the study.
That it would be followed by my next question, that how long would the immunity last with these vaccines?
So at the moment, what we know is that we know that the people who were involved in who were in the trial initially, it's been 6 months since they got the vaccine, and they have immunity right now. So at this moment in time, we can say it's you can have immunity for 6 months, but the anticipation is that it's going to be longer. How long? Actually, time will tell. We can't pinpoint when we will need a booster, but just looking at the prior data, and we know all the childhood vaccines that we have got, all of us have gotten in our kids, you do need boosters to these vaccines. What would be the time frame? I think that time will determine. So we just need to know this is a new disease, new vaccine, a lot of things will change. So hopefully in a few months, we'll have a little bit more clear answer in terms of how long the immunity would last.
Okay.
I'm hoping it would be a long immunity, but we'll see.
We got our fingers crossed. So for people who've had COVID already, do they still need to be vaccinated?
Absolutely. So having COVID certainly does give you immunity. Having the COVID infection itself does give you immunity. But these studies did show, the trials that they did, that the vaccine gave a much more stronger and robust immunity on top of your infection. So having an infection certainly does protect you, but you are recommended to get the vaccine after your infection is over. Having said that, CDC did mention in their guidelines that, and that's because there's no shortage of the vaccine, that if somebody wants to wait for 90 days, it's okay to wait, because the thought process is that right after your infection, you have had COVID infection, for at least 3 months, you would not get, chances are that you would not contract the disease again. So just for the fact that there's a shortage of vaccine, you can hold for 3 months and then get it. But otherwise, the recommendation is that you finish your quarantine after your infection is done, you're fever-free, and you can get the vaccine.
The other question that I see a lot these days on a lot of forum is, can pregnant and lactating women get the vaccine? Is it safe for them?
Yeah, so although the trials both for Moderna and for Pfizer did not have any participants who were initially pregnant or lactating, but with the knowledge that the researchers and these experts have for the kind of vaccine it is, both CDC and the American College of OBGYN, they both recommend both pregnant and lactating female to consider getting the vaccine, however, with consultation with their OBGYN so that they can discuss risk versus benefit and make a informed decision with their doctors. So yes, CDC and American College of OBGYN, they do recommend to talk to your OBGYNs and make a shared decision for getting the vaccine.
Okay. One concerning question for all mothers: can children get the vaccine? And if yes, when?
So unfortunately, this trial did not include the kids. Moderna was 18 and over and Pfizer was 16 and over. Currently, they both are doing trials for kids. I think they're down to 12 years old right now. I'm very hopeful that something would come up around, hopefully later this year, mid to late this year, and we will know. But so for now, there's nothing for kids, but hopefully there should be something later this year. Thankfully, this disease has not affected the kids. So we're keeping our fingers crossed and hoping for the vaccine to come quickly for kids too.
Well, my last question for you before I jump to my next question with Arun: do we have to pay for the vaccine?
So my understanding is that you do not. So if you do have insurance, your insurance will cover it. And if you do not have insurance, I think the vaccine, you don't have to pay for it. And that regardless of what your immigration status is. So please, somebody from King, if you guys can correct me if I'm wrong, but my understanding is that you do not have to pay.
Well, with that, thank you very much, Dr. Maliha. I will now move on to my next panelist, Arun. I do have a question for you. Why do we need to wear a mask and physically distance ourselves after I get the vaccine? Because a lot of people are under the impression I got on the vaccine. I believe a lot of our moms are thinking if we get the vaccine, we could be out there walking around. Why?
So it's my understanding, and Dr. Abbasi and Dr. Barney, please weigh in here. It's as I think Dr. Abbasi was saying earlier, it still takes a couple of weeks for the immunity to be reached, and the two vaccines have different they're almost close in the 90s percent of immunity. So until you get that level of immunity, that it's recommended that we still continue to do the same public health behaviors that we've been learning to do well, including mask wearing and social distancing, and hand washing, all of those basic pieces. And after that, I'm going to defer to my physician colleagues here in terms of is the guidance to still wear masks after the 2-3 week period?
Yeah,
absolutely.
No, Arun is absolutely right. So that's no vaccine is 100% protective 100% of the time. So that's one thing. But then the other thing is that, we know from the studies that have been done that these vaccines are highly effective at preventing disease. Mm-hmm. What we don't know is how effective they are in preventing infection. So somebody, if you have the vaccine and you are protected against the disease, but you may still get the infection in your nose and carry around and maybe give it to somebody else, So that may be another reason to keep wearing the mask and all that until and doing all the public health measures that we've been doing until we know that for sure, and until the transmission in our communities are down to a very low level.
Okay, well, thank you very much. With that, I would like to share a few slides that I've received from the King County. If I have the permission, would you want me to share the slides, Arun?
Yeah, I think you can do it, or I can do it as well.
Go ahead. Absolutely.
Sounds good. Yeah, so give me just 1 second here. Okay, let me know. Are you able to see it?
Yes.
Yes.
Yes,
Okay,
we can see
perfect. I think I need to go back one slide deck. So, Dr. Abbasi and Dr. Burney have talked about the details of the vaccines themselves. And now if you're wondering, well, how do I sign up? When do I get to go get it? Well, this next set of slides is really meant to support, the community and you as individuals in making the best choice around whether or not you want to get the vaccine and where they're available. So one of the big things to know is where are we in the phases? So Washington State has the COVID-19 vaccine phases that comes from the Department of Health. And we are right now in phase 1B, which is really geared for people who are 65 and older and people who are 50 years and older, or they live in multi-generational households. So that means if you have both elders and grandchildren in your home, then that's considered a multi-generational household. And then later in the spring, we'll be going into phase 1B2, which is really for high-risk critical workers, those in fields like agriculture and congregate settings, food and grocery, K through 12 educators, and public transit, fire, law enforcement. Those are the folks who will be eligible to receive the vaccine in phase 1B2. And then in 1B3, it's people who are 16 years or older with 2 or more comorbidities or underlying conditions. So Sarah, you might be one of those people who would be eligible under 1B2 if you're diabetic, right? Because you have an underlying health condition.
That's good to know. For some reason, I was thinking I would be in probably in tier 1, tier 4, but well, that's good to know.
I mean, I think the operative word is 2 or more or underlying health conditions.
I do qualify in that case.
There you go. And later on, it will show you how you can figure out whether or not you qualify and which phase you qualify for. In 1B, tier 4 are high-risk critical workers who are 50 years or older and who work in certain congregate settings. So some of the settings that are noted under tier 1B2. And it's also, people, staff volunteering in those settings. So homeless shelter is considered a congregate setting. So if you are a staff member in homeless shelters, then this is where you would be fitting in terms of your eligibility. And also people who are experiencing homelessness. And then summer and fall will be the future phases. And, there's still a lot of information in terms of planning about how and when phase 2 will be fine-tuned and when it's going to become more available in terms of the timeline for those aspects. Any questions so far? If not, I'll move on.
Absolutely.
Any questions? Sorry, I missed that.
This is important.
So, Sarah, how do you know if you're eligible? How do you know if you're eligible, right?
Well,
that's a big question. And when
my first thing was I called up my doctor and he said, well, I'm still waiting for my vaccine. So you know what, go register. Go in the Phase Finder and find it.
Perfect.
Which was very easy, I have to say.
Yeah. So, if you want to find out when you're eligible, this is where you go. It's called the findyourphase.washington.gov Phase Finder. And it's run and managed by the Department of Health. And it helps you determine if it's your turn to get the vaccine.
Okay.
And all of the responses will be held confidential, and they're not asking for anything personal. They're asking about your zip code, is asking about whether or not you work in healthcare, how old you are, do you live in a multi-generational household? So all of the various criteria that determine each portion of the phases are the types of questions that help navigate a user through to understand if you're eligible in this particular phase and when you might become eligible.
And they need honest answers.
Yeah. And, nothing in this information will be shared with anyone. It remains confidential. And it completely allows you to just find out if when you're eligible to get your vaccine under what phase.
Okay.
And then once you understand the extent to which you're eligible, Phase Finder tool can also help you navigate to a vaccine site where you can make an appointment to get the vaccine.
Okay. Before we move on to the next slide, I just want to add this for our audience, that all these links would be put up on our Facebook page, and you're free to share them with, so it will be just one click. And I will collect all the information, put all the links, so they don't have to go and Google anything. It'll be under one post.
Great. So when you, when you get your eligibility determined, there are a number of different places where you can get the vaccine. Hospitals, so there are a number of hospitals that are here: UW Hospital System, Harborview, Evergreen, and Overlake. There are a number of in-store pharmacies, particularly through QFC, Safeway, Fred Meyer, Walgreens. Vaccination sites, Kent and Auburn, and there's some new pop-up clinics that are also coming up. There's one through the IAWW, Amazon, Microsoft is a recent one that's also coming online. You can also ask your primary care physician if that particular clinic that you're accustomed to going to is giving vaccines at the time. And DOH, generally tends to update their list of locations as more vaccine providers are coming online. So you can have that information. But the big issue right now is, Sarah, you were saying your doctor hadn't even gotten the vaccine, and that's because there's a issue with supply. We are, able to plan for about 3 weeks out in terms of the vaccine supply. And this helps vaccine providers sort of post the appointments accordingly. So if you're looking at different sites and you're not seeing appointments past 3 weeks, that's probably one of the reasons, is because of the supply issue right now. But the Phase Finder will also help you understand and help make appointments. And that being said, you can still look at the variety of the vaccine providers in our communities that are, providing the vaccines. And I apologize, my children are crying upstairs. So if there's background noise, that's what that is.
That's okay. Not that we hear any, but.
The other issue is, even with the supply, there are a limited number of sites that are able to provide adequate refrigeration for the vaccine and other related requirements. And so often you'll see in the news that there are certain vaccine providers and sites that are giving out vaccines and like letting people in community know, like, hey, I have some vaccines that need to be administered within a very short duration of time. And that's usually related to how long that refrigeration period is.
Okay.
And, a lot of providers are being really good about providing real live updates in terms of when those extra dosage that day or that couple of days are coming on live. So there's for example, I'm on Families of Color Seattle. It's a Facebook group. There are folks there who are constantly posting like, hey, there are some appointments available like today or tomorrow. If you haven't made an appointment and you're eligible, please go on. And, so that's another way of having more real-time information in terms of where you can get vaccinated. So here's a list. This slide really helps a user navigate where you can get vaccinated in King County. You can also access this page in a multitude of different languages. And it will also give you some updates in terms of any sort of site-specific information. For example, the piece here around the clinic in Auburn, if they're moving it because of cold weather, those sorts of more real-time information will also be available on this website. And so we had a question earlier about the cost and whether it's free or not. So both of the vaccines are provided at no cost. You will need to still get 2 doses for both vaccines. And as our doctor shared, they are considered safe and effective through a lot of different avenues and going through the trial process. And the phases that we talked about is really looking at people at highest risk will get vaccinated first in the phases. And some things to keep in mind that you may feel side effects of the vaccine. Like a lot of other routine vaccines, you might get a sore arm or fever or headaches, fatigue after getting vaccinated. And those are common side effects from this vaccine. And, as we talked about earlier, it's still very important to keep that mask on and practice the physical distancing and all of those, public health habits that we have grown very familiar with and accustomed to, because there's a time period for after you get your second shot to reach the immunity. And like all vaccines, it's not 100%. And so until we get the community transmission level very low, we need to continue to be able to practice those the health behaviors that about wearing the mask, limiting activities outside the home, practicing social distancing.
Okay, well, thank you very much for that.
Yeah.
That was good to know. I mean, I didn't know that. I mean, I was hoping, we'd have to stop wearing the mask pretty soon, but no, I think we will. Since we posted about the event going live today, for some reason my cell phone and my email was bombarded with a few questions from people who know me, and I would like to send it your way. The first question that I got was, my mother-in-law is kind of afraid of the side effects of the second dose. She will get it though. Her friends and some folks who have received it told her that they had more pain, swelling, and fever after the second dose. Is it true that the second dose impacts our system more?
Yeah, so I can answer that question. So, as we know, like after you get the vaccine, the most common side effect is some soreness of the arm, but some people may develop, like body aches, headache, fever, chills. And these symptoms are a little bit worse after the second dose. And the reason is that after the first dose, your body develops some immunity, but when you get the second dose of the vaccine, there's a more robust immune response, and so the symptoms are more exaggerated. So what I tell people is to look at it as a positive thing, because what that means is that the vaccine is doing what it's supposed to do, and your body is building that protection, against the virus. And the other thing to remember is that these symptoms are short-lived. So it may start a few hours after the vaccine dose, and it may last for a day, 2 days, 3 days at the most. And many people have been able to work through it, but others, they've taken a day off after they got the vaccine. And if you need, you can take some Tylenol, but just remember that these symptoms are short-lived, and after you get over it, you're back to normal.
Okay, well, thank you very much. My other question that I got was, my father is visiting from Pakistan, and I lost my mother to COVID already. My first question is, can my father get vaccinated on a visit visa? Arun, would you have an answer to that?
Yes.
We were actually talking about this earlier in our work group, and I think what the best avenue right now is we're actually looking into with some of our policy colleagues in public health to understand whether or not people who are visiting this country, family members, are able to get vaccinated. I don't have an answer for you at this moment, but we are looking into it, and we can provide an answer as soon as we have one.
Her next question was that if he cannot get vaccinated, I am the prime caregiver and he's high risk. Do I still qualify, and when?
Yes, so looking, if you look at the Face Finder right now, so the people who are like 50 and older, living in a multi-generational home where there's an older individual, I feel like they do qualify, but there is that age cutoff too. So if somebody, so if this person is less than 50, they may not qualify at this point, but if they're older than 50, then they would qualify. So if you look at the one B tier 1 criteria, right? So that's where we are right now. So
Right.
it also includes not only people who are 65 and older, but all people 50 years or older in multi-generational households where individuals from 2 or more generations reside, such as an elder and a grandchild.
Okay.
So if this person is 50 years and older, then they should be able to get the vaccine uh, right now. Of course, later on as we move forward, others
Mhm.
become eligible as well.
Okay. The next question that I got was, I'm visiting my family in London and I can get the first dose of vaccine here, but I can't stay back to get the second dose. Can I get my second dose in Seattle?
I think logistically, I think the best thing would be to get the 2 doses where you are. Because if whoever gets it at some other place, they come here, it would be hard to schedule for a second dose, hard to find. Because usually when you schedule yourself for the first dose, you're automatically in your clinic or wherever you're kind of eligible for the second dose. So if it's an emergency and there's nothing you can do about it, then yes, that could be a consideration. But at least my recommendation would be to get the 2 doses from the country where you're living or where you're getting the first dose. I don't know, Dr. Basi, if you have any other recommendation regarding that.
Yeah.
She added that her eligibility for getting a vaccine in Seattle, which she's looking at, is somewhere around in summer. And for some reason, she's able to get it in London right now.
So it looks like she's a low risk patient, low risk person in any case.
I believe so.
Yeah. I think I agree with Maliha. As much as possible, try to get both your doses at the same place. The other thing that I would also mention is that, you have to be very careful that both the doses that you get are the same vaccine.
Mhm.
Of course, right.
UK, I don't know which vaccine is being given because right now what we have over here is Moderna and Pfizer, but I know in UK they've been using a lot of AstraZeneca. So if you get a first dose of AstraZeneca, the second dose will have to be AstraZeneca, And the other
Okay.
thing is also the interval. You have to be careful about the interval, So right now their recommendation with Pfizer is like the second dose is 3 weeks out. In case of Moderna, the second dose is 4 weeks out. AstraZeneca, the second dose is 8 weeks to 12 weeks out. So all those things have to be factored in when you make these decisions.
Okay, well, my last question for tonight is, can we travel between the 2 doses? International travel.
Well, in my opinion, and this is coming from my research, what I know, see, in terms of travel, if it's a emergency, a medical emergency, a family emergency, you really can't do anything.
Of course, right.
But if it's not an emergency or if it's something urgent that can wait, I think whoever asked that question should make every effort to get both the vaccines and then make that travel. We still have to be careful that CDC still does not recommend non-essential travel. But I mean, it's understandable if it's an essential travel, if it can wait, get the 2 vaccines and then travel. If it's an emergency, the time frame between the 2 doses, the studies that were done, as Seema mentioned, it was 4 weeks for Moderna and 3 weeks for Pfizer. But what we have known now that if for any reason you cannot get it within this time frame, you can push it potentially to 4 weeks to 4 to 6 weeks. But that's usually in a case of an emergency. So if it's not an emergency, I would not recommend anybody traveling between. And plus, after the first dose, it takes time to build that initial immunity. And it's the second dose that actually gives you that robust response and immunity. So if it can be avoided, I would certainly recommend to get both and then do the essential travel, that is.
Going back to the registration part, I am just thinking, can people actually register themselves in different counties and whatever opens up first, or does it have to be the county that you live in?
I'm going to defer to my colleague Naisha and Ali. Maybe they have a answer, as I'm not familiar exactly with that.
Naisha, you're on mute.
Ali, are you still there?
Yeah, go ahead. So what was the question? Can we get between two different counties?
Yeah,
Yes,
can you register in
at
different
different
counties?
counties?
No, you can. That puts you in a,
Thank you for unmuting me. I couldn't unmute.
No, that makes you you're gonna shop for vaccine, but generally we ask folks to do the same county that that you get the first shot. Once you get shot, you get a card, and then you carry that card to the same place back where you get it from. So Naisha, go ahead.
Yes, thank you. It's not entirely impossible, but as Ali is recommending, just logistically, it's easier to try to remain within the same county, and also to try to ensure that you're registered for that second dose when you receive the first dose. I know we have a limited supply, so that's not always, the reality. And again, it's not entirely impossible, but it's highly recommended to try to make sure that you're enrolled for the second dose when you receive the first dose. And I know in some cases, some community health centers may have offices with providers in multiple counties. So if that is something that is done through your health provider and you can guarantee, that second appointment. However, if it's a situation where you're receiving the vaccine at a potential like community vaccination event or pop-up site, we kind of recommend to try to stay within the county just to ensure that vaccine is available and that you can get the second dose.
Thank you very much. We do have a question from the community. Are the two doses identical?
Yes, the two doses are identical. So like if, the first dose is Pfizer, the second dose, you should still get the Pfizer, and they'll be exactly the same thing and the same amount. And the same goes for Moderna.
The other question that I just got was, can you get more than one vaccine, as in from different companies, if they want to get Pfizer, both doses, and then get the other vaccine from the other company just to be extra safe, I guess?
I think there are not enough vaccine for everybody. So somebody getting two vaccines would ethically be not okay. So
I mean, here we're trying to tell people to go get a vaccine, let alone, but I'm glad to hear that people are taking the precautions in our.
No, I think my understanding is that no. I mean, one vaccine, both Pfizer and Moderna, they have such amazing results that I think after you have gotten one, there's no point of getting the other one. But let's see, Seema, do you have any other thoughts on that?
No, I agree. I mean, at this point, people are having a hard time getting just one set of immunizations. And, as you pointed out, Amelia, so like between Pfizer and between the Moderna, the efficacy and the safety data is so similar that, you should be fortunate to get any one of them. And I feel like we're pretty well covered.
Yeah. Okay, well, in that case, thank you very, very much. I will have this session saved on our pages. And if you wish, I can send you the link. For those who have joined later, if we could just do one round of introduction once again, so people who've joined in later would know who is on the panel. Dr. Seema, can we start with you again, please?
Yes, so I am Seema Abbasi. I'm a pediatric infectious disease doctor, and currently I'm working with I'm part of the King County Vaccine Outreach towards the South Asian community.
Thank you. Dr. Maliha.
Hi, everybody again. I'm Malia Burney. I'm one of the internal medicine physicians. I work here at one of the Seattle hospitals.
Thank you. Arun.
Hi, all. I'm Arun Sambatero. I'm with King County. I've been working with public health in the COVID response since March, and I'm also part of the community mitigation recovery effort and the South Asian community vaccine outreach effort.
Ali, are you still there with us?
Yes, I also work with Arun and Naisha. I'm part of the King County Public Health Community Mitigation Recovery Team. I'm now administrator for all faith-based communities. So I just dropped the link for if any communities from faith-based community and South Asian folks would like to participate, potentially using the faith facility as a vaccine distribution site. I dropped the link. Please
Okay.
share that with your communities.
Absolutely, I will.
And we'll contact them. Thank you.
Naisha.
Hello, yes. My name is Naisha Williams. I work out of preparedness and community mitigation and recovery at Public Health Seattle King County. I'm trained in epidemiology and I lead for COVID vaccination in BIPOC communities.
Well, thank you very, very much for being here tonight, for such great information. I'm sure we've got a lot of questions covered. If we still have any questions, I will send them your way and I will post it back on our pages. But thank you very much for doing this. We're very proud to have people like you in our community who looks after us like their own family. I hope you all have a wonderful week and a peaceful one and a healthy one. Thank you very much and good night from us.
Yeah, no, thank you so much for doing it, Saira. We
Thank you
appreciate it.
very much. My pleasure.
Thank
Thank
you
you,
so much
Saira.
for organizing this, Saira.
Thank you. Such a pleasure. Thank you very much, everybody. Good night.
You all, good
Thanks.
night. Have a great weekend.